Everyone, welcome to today's webinar. I'm Kristen from the New England PTTC, and we are glad you're all here today. I hope everyone is warm and safe if you're in a part of the country having unreasonably cold weather today. Today's webinar is Building the Latinx Prevention Workforce with Pierluigi Mancini from the National Hispanic and Latino ATTC and PTTC, and we are very glad to have him here today. So without further ado, I'm going to turn it over to him to get us started. I'm going to put a little bit of information in the chat, so if you how to connect via phone if you're having trouble and that sort of thing. So, and if you have any questions, you can put them in there and I'll keep an eye on that. But without further ado, we'll hand it over to Dr. Mancini.
Thank you so much, Kristen, and hello, everybody. I know that for most of you, you're probably extremely cold, and I hope everybody is safe, and hope that we will not have any interruptions during the presentation. But I'm really happy that you're here today. As Kristen said, my name is Pierluigi Mancini, and I want to welcome you to Building the Latinx Prevention Workforce. Before we get into the content, I want to spend a couple of minutes telling you who we are. The National Hispanic and Latino PTTC is housed at the National Latino Behavioral Health Association, or NALBA. NALBA is a nonprofit organization and is located in New Mexico. The mission and goal of NALBA is to influence national behavioral health policy, to eliminate disparities in funding and access to services, and improve the quality of services and treatment outcomes for Latino populations. NALBA's executive director is Mr. Fred Sandoval. The National Hispanic and Latino ATTC, through NALBA, wants to also share the NALBA priorities, targeted capacity expansion of mental health services for Latinos, Latino behavioral health, evidence-based practices, legislation to increase the number of counselors, therapists, other behavioral health practitioners, preventionists, funding for co-occurring disorders of alcohol and substance abuse, the opioid crisis in the Latino community, and suicide prevention. As most of you know, our PTTC is part of the TTC network, a multidisciplinary resource for professionals in the prevention field. The PTTC network was established by the Substance Abuse and Mental Health Services Administration. It's comprised of 10 domestic regional centers, 2 national focus area centers, and a network coordinating office. Together, the network serves the 50 U.S. states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, and the Pacific Islands of Guam, American Samoa, Palau, the Marshall Islands, Micronesia, and the Mariana Islands. This is the map of the TTCs. Our center has the national focus for Hispanic and Latino communities and the workforce that provides services to these communities. I serve as the project director for our PTTC, and I'm joined by Dolca Michelle Zelaya, who serves as project coordinator, and Priscilla Giamasi, who's our executive administrative assistant. We are delivering this for you today through our host, the New England Prevention Technology Transfer Center. And the New England PTTC provides training and technical assistance services to prevention professionals and stakeholders in the 6 New England states. The New England PTTC is one of the 10 regional centers providing these services across the country. More information about the New England PTTC and other resources are available on their website, pttcnetwork.org, and then look for New England PTTC. This reminder is more for me than from you. So at the end of the workshop, please follow a link that will be provided for you to be able to give us the feedback for this presentation. Now let's get to work, building the Latinx prevention workforce. Let me start by reading my favorite quote attributed to Nelson Mandela. If you talk to a man in a language he understands, that goes to his head. But if you talk to him in his language, that goes to his heart. I think this is going to set the tone for our workshop today. Now, in a in-person training, I would be asking you these questions, but I still decided to leave these questions in hope that you can share some of this if there is a chat option during the workshop. But I want you to start thinking about this. If you've worked with individuals from other cultures or immigrants or refugees, what has worked? What have been some of your challenges? And why do you think it is so difficult to reach these communities? And hopefully throughout the presentation, you'll be able to see some areas where maybe this was the case. But if not, then I hope you do bring them up during the Q&A at the end of the presentation. Now let's define the Latino community. Or is it the Latina or the Latinx? One thing that you need to know is Hispanics are not a unitary culture. There are many factors that do tie the Hispanic community as an ethnic group. For example, Spanish as a language, or family as the social structure. In some places, even the Catholic Church. But there's also many differences among this population. National origin. There are over 22 countries where Hispanics or Latinx can come from. There is also racial, political, socioeconomic issues that come into play. How long has the individual been in the United States? I remember when I first started my work, I went to New Mexico because in Georgia, I couldn't find any Latinos working in behavioral health, either treatment or recovery or prevention. So I said, oh, New Mexico, they have a lot of Hispanics. So I went to New Mexico. And they said, yes, we have a lot of Hispanics. And yes, we have prevention programs, but they're in English because we've been here 500 years. So there is an issue about trying to put in the same place anyone that identifies as Hispanic and Latinx, because the history is very broad. Even how they came into the United States, when they came to the United States, what is their level of acculturation or assimilation? And something as simple as the name in this particular segment of the presentation, what do we call this community? Now, there is no simple answer for that, but what I know has worked is that usually we let the community tell us that. So you'll see in some places when it comes to business, they use the word Hispanic, and you have the United States Hispanic Chamber of Commerce. And Hispanic tends to be the preferred terminology for business. But for community, it's either Latin or Latino or Latinx. And you see that because many community centers are Centro Latino or the Latin American Association here in Atlanta. So there are places where the community identifies themselves. And when it comes to an individual, most of the time that individual is going to self-identify by country of origin. And they'll say, yes, I'm Puerto Rican, or I'm Mexican, or I'm Argentinian. So there's over 60 million Hispanics in the United States, individuals that identify themselves as Hispanic. And, you know, there are some items that I'm going to define in a minute that it comes to where they come from and what causes this identification issue. There are different cultural groupings. So if you look at the external markers that people usually use to identify someone from another race or another culture, you will see that in Latin America, there is someone that looks just like you if you look at those external markers. And the reason is because in Latin America, you have Afro-Latinos. In the Caribbean littoral, usually Cuba, Dominican Republic. And then in Panama, there's a lot of Afro-Latinos in Panama. And the history behind that is too extensive to cover in this workshop, but it is worth taking a look at. If you follow our monthly videos, we just released our February video at the National Hispanic Latino PTTC honoring Afro-Latinx during Black History Month. And there is a deep history. We also have Euro-Latinos. Many Europeans flew Europe and came to South America, Argentina, Uruguay, Brazil, and many others, people from Germany, United Kingdom, even Arab and Italians, Eastern European Jews. So we have very white, blue eye, blonde hair, Hispanics in Latin America. We also have Indo-Latinos, which are mestizos, Africans and Europeans assimilated with the indigenous population, and Asian Latinos. Many of them were brought to South America as slaves to build the railroads. So we can look like anyone in the world. Now, inside the United States, we have an issue where in most research opportunities, people are asked to identify only by those top three. Are you Mexican, Puerto Rican, or Cuban? Because they are the largest three groups. But remember I said there's 22 other countries. Everyone else gets bundled into this other. And we're missing a lot of information that can come out of that. And the only way that we can really learn that is by studying who in our community belongs to those associations. And then what about Latinx? Now, if you haven't heard Latinx before today, it is an adjective that many people use as an alternative to using Latino or Latina. And in academic centers are adding it to their titles. I know that the National Latino Psychological Association last year changed their name to the National Latinx Psychological Association. And I'm sorry, they used to use National Latino/A, and now it's Latinx. So, it's becoming popular among artists, politically active youth, and there are national media channels that are also using it. Now, this word has some staying powers. There's actually some dictionaries that are taking time to define it. And one definition is relating to people of Latin American origin or descent used as a gender neutral or non-binary alternative to Latino or Latina. And then you have the other side. Many people do not want to use it, do not believe in X identifying the gender. Even the Royal Academy of Language of Spanish in Spain came out officially last year and said Latinx was not a Spanish word. So you have both sides, but what you'll know is that it is catching a lot of strength, and you're going to continue to hear it, especially as we continue to move forward in working with our community. Now, I have a poll question that is coming up, and I think there will be an opportunity for you to answer. So according to the US Census, how many individuals who are foreign born are living in the United States? 14 million, 24 million, 34 million, or 44 million?
We'll leave this open for a few seconds so
Thank you.
other people can vote. I'll give it 5 more seconds. Okay, looks like most people have voted.
Okay. Is there a way for us to see the results, or can you tell me the results?
Oh, yes. Let's see, it's 8% voted 14 million, 29% voted 24 million, 39% voted 34 million, and 24% voted 44 million.
Excellent. Thank you, everybody, for participating. The answer is 44 million. 44,728,721 to be exact, according to the 2018 US Census. So I share this because there seems to be misunderstanding about what is it, who is this population that we want to reach out to that we may not be reaching. So keep that number in mind. There are 44 million people living in the United States that were born somewhere else, right? So that's called a foreign-born individual. There's 283 million US-born individuals. This has nothing to do with heritage or ethnicity. This is just all 313 millions in the US. Now, the foreign-born, most of them, over 50%, are coming from Latin America, 31% from Asian countries, and 11% from Europe, which is a total opposite of the initial immigration of the early 1900s. And the Asian countries present a little bit of a challenge because in Latin America, you have most countries are Spanish speakers. And Brazil is a Portuguese speaker. So you really have those two main languages to deal with. But from Asia, you have multiple countries, not only with multiple languages, but also with multiple dialects within their countries. When it comes to the Hispanic or Latino population in the United States, 67%, these are the 60 million I mentioned a little while ago. It's about 18, 19% of the population. 67% were born in the United States. So we need to break the stereotype that most Latinos are foreigners. 67% are US born. 33% are foreign born. And this is just for the Latino community. So most Latinos are born in the United States. In fact, the growth in the Hispanic community has been due to birth rates and not from immigration, like it's usually portrayed. Only 33% of Latinos are foreign born. But here's the challenge. When it comes to foreign born individuals, and this is for all 44 million, 46% report that they speak English less than very well. 46%, less than very well. Now, that places them in a category called limited English proficiency. And I want you to keep that number in mind because 46% of 44 million, it's about 20 million people. And if they cannot speak English very well or are at different levels of learning English, and we don't have any information or any programs to reach them, that's 20 million people that's going without any of the great programs and products and services that you have. And then the last stereotype I want to start breaking is the foreign born by occupation. So yes, usually in the United States, those that come in last end up getting real horrible jobs that nobody else wants to do. And that continues to exist. I think that's part of coming to the United States. But it's not everyone. And we need to understand that we have 16% are management, business, science, 24% are service occupations, and then 13% are sales and office. And then we also have transportation, and we also have other industries. But these are, most of them are professional industries. 24% are in the service occupations. We need to keep that in mind. And then as this whole process leads to developing this Latinx workforce, we really need to look at linguistic competence. So language is often the primary barrier to an individual accessing services. 46% of those foreign-born speak English less than very well. So the best way to explain this is through a story. So let's say you go to a mechanic, a foreign-born individual, that's your mechanic, and you explain to him or her why you came. He or she diagnoses your car, tells you in the best English that they have what could be wrong with the car, and that is going to cost $700. You know, I don't know why, but every time I go to the mechanic, it's $700. I think they teach them that in school, $700. It always costs $700. Now, he, she, or they is able to tell you in English because they have the functionality of English as it relates to this work. But if you were to ask that individual to participate in a conversation about current events, about traffic, even about getting directions to your next destination, they may not be able to do so because they don't have that English content. Every immigrant, refugee, asylum seeker that I've ever met wants to learn English and is actively pursuing learning English. But we need to remember that it takes between 3 to 7 years to master a new language. Those of you that have learned other languages know this. 3 to 7 years. So we need to be able to meet the individual where they are and not have an unrealistic expectation that, okay, when you learn English, then you can participate in our programs. Then there is 3 areas of language that I want you to think about because they're different. The first one is fluency. Now, fluency, in order to be fluent, means to read, write, speak, and comprehend. Read, write, speak, and comprehend. Now, the degree to which the individual or your staff member is fluent will have a bearing on those interactions. So fluency. The other one is attitude. And this can be a personal question and an organizational question. What is your attitude towards working with individuals with limited English proficiency? Am I one of those persons that sees it as a burden? Oh my God, now we have to do this in other languages, or oh man, why can't they just speak English? And so your attitude shows. And nobody wants to walk into a place where we're not wanted. So if I walk into an organization and my English is limited, is broken, maybe I ask if you have someone that speaks my original language. How do I respond to that? How does my organization respond to that? And then even at a sub-level of that, how many people have difficulty working with those that have accents? Are you open to that? And depending on where you're from, your accent in English can be heavier than in other places. And I know I've lived that. I've spoken with immigrants, refugees, and asylum seekers, and sometimes it is difficult for me to understand. But what I need to do is work with them to make sure that we can understand each other to the best of our abilities. So what is my response when someone has to do that? We often hear the words interpreter, translator, even language. What are these words? What do they mean? Well, let's go ahead and define them. As you can see in the cartoon, 2 cats are reading a book and said, oh, great, this book is in cow. So language is the words, their pronunciation, and the methods of combining them to be used and understood by a community. translation or a translator. Translation is the conversion of written text from one language to another. So we translate a brochure. We don't hire a translator to come tell us what this person is saying. Translation is the written text. Interpreting or interpretation is the re-expression of spoken messages in spoken form in a second language. So I would need an interpreter to tell me what this individual is saying in their own language. And those interpreters and those translators must be fluent. So we need to measure fluency. They must be able to read, write, speak, and comprehend both languages. So how do we ensure language access? You know, these are just some examples of questions that we can, as a provider, look for if we hope to serve individuals, if we want to open our doors to folks who speak other languages or those that have English, limited English proficiency. So do you know what the language needs of your community are? And this is really simple to find out. There is two ways. You can go to the US Census webpage, and the US Census, if you know how to navigate those charts, can give you that by zip code. They can tell you what those languages are by zip code. If you don't have that savvy, I know I have a hard time finding it at that level, you can get it at the state level right there on their front page. So it tells you what languages are spoken in your state. But if you don't have that, all you have to do is drive around your service area. So let's say where you're located, you're serving the 10-mile radius or 20-mile radius. Just drive around. You're going to see two things pop up whenever immigrants move into a neighborhood. You're going to see supermarkets or food stores that cater to that culture, and houses of worship that offer services in other languages. You'll also see restaurants, and you may see some other signs, but supermarkets and houses of worship are usually the two biggest ones. So how do you know your clients prefer language? You know, the culturally competent thing to do is always to ask. Do you have staff that's trained in language services or interpreting? And how do you let your clients know that there is language assistance services so they can come in and ask you questions? It's, you know, it's really difficult to know how to do this, and it can be really scary. And I'll give you some tips in a little bit of how we can overcome that. For now, let's ask a second poll question.
Okay.
From the
So
list below. I'm sorry, did you need to give some instructions?
I just split the options into two polls. So if you don't see the choice you like here, you can wait a second, and there's a couple other options I'm going to show in a minute.
Okay, great. So from the list below, what are the top four foreign languages spoken in the United States? And this list has Chinese, German, Russian, Spanish, Arabic, Tagalog, Vietnamese, French, and Korean.
Okay, I'm going to switch to the next poll, and then I'll show the results for each. Okay, here are the other options. So if you want to vote, there's also Tagalog, including Filipino, Vietnamese, French, including Cajun, and Korean for some other options. Okay.
Thank you, Chris. So what would be the top 4?
Let's see. So it looks like almost everybody chose Spanish as one of the options. Chinese was the second most popular. Arabic had 43%, and then a bit less for Russian and German. And let's look at the others. French had a lot of votes too, about 50% of people, and then Vietnamese, Korean, and Tagalog in that order going down.
Excellent. Well, thank you again, everybody, for participating in this. You know, the top 4 are Spanish, Chinese, Tagalog, and Vietnamese. Now here, they vary depending on where you live in the United States. And that's why it's important, and it sounds like many of you know your community, it's important for us to know what that means in our service area. So we have, after Vietnamese, Arabic, French, Korean, Russian, German. So those are all the ones you guys covered. So that means that you have good knowledge of your neighborhood. Now, this is an interesting map, and there's a couple of versions of this, but this is the latest one I found in 2017. If you remove English and Spanish, what is the next language in your state? And many people were surprised about the variety of languages all over the United States. In Florida, Haitian Creole surprised a lot of people. You know, where you may be in those 6 states, I know that there's Portuguese. When I was up there last time, there's a large Portuguese community, and you see Portuguese all over the place up there. And French, which it's also one of the ones. Now, Portuguese is not one of the big ones nationally, but it's very regional. So once again, I want to bring you back to this graph. 46.8% of individuals with limited English proficiency report they speak English less than very well. So when we talk about how do we build this Latinx workforce, we have to take into account all of those elements. We have to take into account race, ethnicity, country of origin, language, in order for us to be able to do that. You know, workforce is your most important resource. And for many of us in Hispanic Latinx communities and the substance misuse prevention field, it's an absent resource. In Georgia, when I first started a prevention program here in 2000, the Department of Education wanted me to look at a middle school, and that had a large number of Hispanic youth, and they wanted to bring some programming because they were having a difficult time. And I could not find anyone in the state of Georgia who was bilingual, who was working in the field of prevention. So I had to build my own workforce. You know, the journey towards building the Latinx prevention workforce needs to pay careful attention to those issues of ethnic and cultural appropriateness and overall cultural competence. We know that culture and language pose significant barriers to providing the appropriate services for some populations. Overall, many of you listening to this webinar understand that not everyone is cut out to work in the prevention field. Usually, you know, we have to learn, you know, how to stretch a dollar. We work more than 40 hours a week. And in many instances, it is a thankless job. We affect lives that people don't understand until many years later, and we know what we can do, but it's often not appreciated at the same extent that other fields that have instant results. So the type of person that we want to focus on when we're looking at building this Latinx workforce needs to fit some of these areas that are absent. So if you want to be a culturally competent organization and provide services for speakers of other languages, you must, let me repeat, you must budget for it. Cultural and linguistic competence is a budget item. You know, the lack of bilingual and bicultural prevention specialists, it's a national issue. It needs to be addressed at the local, state, and federal levels, but it's happening everywhere. The lack of bilingual and bicultural providers. And this is where you and your partners come in. So you can develop and deliver services to individuals in your service areas who speak other languages. And one of your biggest allies is going to be those organizations, those businesses that I mentioned earlier. You know, you find that one champion from that community and you merge them with your services and you start building. The lack of language appropriate community information is where budgeting comes in. So one mistake is the first place budgeting comes in. One mistake many people make is that they use Google Translate, or they ask someone they've heard speak another language before and assume they are fluent. Maybe they didn't even assume. Maybe they never even thought about fluency. But they just said, oh, this person speaks such and such language. And then they ask him to translate a brochure. And often, at least what we've witnessed in many places across the country, is that a fact sheet or a brochure gets published in another language with horrible grammar, with sentences that make no sense. In some places, words that could be insulting. So what happens is two things. First, you're providing bad information. And second, you're isolating that community further from you. We also need to be careful if we use untrained interpreters. Now, interpretation is a skill. There are certifications and qualifications for people to become trained interpreters. You should never, ever, 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 ever use children for interpretation, ever. Even if it's something innocent, because I know that in the medical field, it could be traumatic when you ask an 8-year-old to tell his mother or father a medical diagnosis. That can be traumatic for the child. But even if it's something innocent, something simple, the fact that we ask a child to interpret for their parents changes the balance of power at home. And if we need our parents to become partners and become engaged in substance misuse prevention, we cannot have the children be in charge. And then we need to use professional interpreters if interpretation ever becomes a need. And if we do those, let's make sure that they've received behavioral health interpretation. You know, there are many organizations, including our parent company, that have wonderful behavioral health interpretation programs. So some strategies for recruiting and hiring have to include planning. You know, the first, I should say, one of the first people that I hired to work in a Latina girls prevention program was hired without planning. And I paid the price. This individual on paper looked like, you know, they had all their ducks in a row. They had studied education. They wanted to be a teacher. I said, oh, this is perfect. They were bilingual. And halfway through the program, they left. And they left me with, I think we had 3 schools, about 60 girls, and no prevention specialist. And the reason she left is because she realized she didn't like working with kids. So that was a horrible job on my part. So again, it was something that didn't exist, huge mistake. I learned many lessons from it. So plan first. Take time to define the role of that bilingual, bicultural prevention specialist. It needs to be a thoughtful process. It needs to be a well-developed plan of action to ensure that you don't hire a person who's not qualified to perform the essential functions of the job. You know, you're looking for a person who is adaptable to change, who likes to work with children and youth. So what I recommend that you remember about recruitment is this person may come from many different backgrounds. Remember, a prevention specialist is not a field, it's not a job in most of the world. And therefore, there is no preparation for it. Individuals come here looking for an opportunity, and they may not even know that this is a great field for them to be in. So I was successful in recruiting because I kept an open mind. One of my best prevention specialists used to be a former newspaper editor. I also had someone who was a dancer, a professional dancer. A professional soccer player became one of our greatest assets. Radio personalities. So people that, traditionally here, we try and find a connection or maybe a degree. And we need to have an open mind and be able to let others in who may not traditionally be part of this. So we need to follow universal policies on hiring employees, establishing minimum requirements. That's going to help us when we hire a bilingual, bicultural individual. It shouldn't be any different from hiring any other employee. We need to make sure that we make them feel welcome. We had another agency that hired a bilingual, bicultural prevention specialist, and within 3 months, he left because he felt totally isolated because he was the only bilingual, bicultural prevention specialist and was not made, felt part of that family. So, making sure that we're able to bring this individual in and make them, part of our family, make them feel welcome. A lot of foreign-born individuals, you've heard this during your cultural competence trainings, are more focused on the experience of the group instead of the individual experience. So they want to be part of this family. Then for supervision and retention, so supervision and retention of bilingual, bicultural prevention specialists are areas that usually don't appear in the literature as much as recruiting and hiring. And the relationship of the worker and their supervisor is one reason why these individuals stay or leave. They're not leaving the job in many cases, they're leaving their supervisor. And we have to be able to develop bilingual, bicultural supervisors. For those of you who supervise individuals, the best way or the best teacher is someone that has been there, someone that has been in the front lines, someone that understands some of the nuances and some of the differences that this culture will bring to prevention. And then we need to support them. And sometimes it's not money. Many times we think, oh, well, we'll try and get you a little bump, we'll get a 5% increase. Yeah, money is nice, right? But what I've come to learn is that many times there are other things that are more powerful. It could be an extra day off. It could be a half day off. It could be some opportunity that comes across your desk that would be great for this individual's daughter or son. You know, those kinds of perks go even further. And because of that, and I know that is because of that, because I also had the same financial constraints that we all have in prevention. The prevention team I built would stay with me 10, 15 years. And people would try and steal them because there were 6 of the only 7 bilingual, bicultural prevention specialists in the state of Georgia. People would try and steal them all the time, and they wouldn't leave because they had that sense of family. So we have to be very conscious of that. So what is the role of culture in prevention or intervention? You know, culture forms a context through which individuals and communities view and appraise their own responses. So how does culture affect an intervention? Over the past 20 years in practice, I noticed there were similarities that minorities and immigrants shared when deciding whether or not to access services, in this case, prevention services, how they communicate, how clients manifest their needs or their symptoms, how they cope, what is the range of family and community support that they're willing to seek prevention for. And then you have to take into account that being a minority and an immigrant, there's also some factors that play a role in understanding why people may or may not want to access our services. And unfortunately, this includes things like racism and discrimination, economic impoverishment, mistrust. Sometimes people think, well, no, I can't go there because I don't have any money. And your program may not charge any money. But if we're not able to communicate that, then that presents a barrier. You know, culture affects an intervention by influencing what type of threat or event is perceived as serious or traumatic. You know, in our world, is underage drinking something serious enough for immigrants and refugees to want to seek out prevention programming? So we need to become familiar with that. You know, for prevention is, you know, using an ecological perspective, integrating evidence-based with practice-based evidence, cultural and linguistically competent programs and services, which, just a little newsflash, in the spring, the National Hispanic Latino PTTC will be launching an e-compendium about evidence-based practices that are appropriate for Hispanic Latino communities. So just for you guys, a little announcement. No one else knows this. And then partnering with community-based organizations, that's where you're gonna find your heroes. You're gonna find individuals that know the community, know how to access the community, and will be able to open doors for you. And then incorporating social justice principles while providing services. You know, biculturalism means knowing both cultures, being able to navigate between both cultures, a sense of efficacy within both cultures, sense of identity, communication, and then social affiliations. There is minimization of intergenerational conflict with biculturalism. You can tailor behavior to situational demands in some cases. It can help with school adjustment, also higher self-esteem, higher social competence, lower involvement in delinquency and substance use. And, you know, we have to be able to appreciate those and celebrate those with the youth who are bicultural who end up coming to our program. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. I added this under health literacy because I see prevention as part of this. So in order for a community with limited English proficiency or recently arrived immigrants to understand what I'm talking about, they need to be able to have the capacity to obtain, that means the information gets to them, process, and understand the prevention information. So sending a brochure home from school may not do the job because the parents may not understand the wording that preventionists are used to using. So we need health literacy. We also need cultural literacy. And this is when we converse fluently in the idioms, allusions, and informal content, which creates and constitutes a dominant culture. So being familiar with the street signs to knowing historical references about that community. Sometimes we don't do enough work to learn about this community and we end up isolating them. So we had an actual case where I was called in to an agency who was having a difficult time reaching the Hispanic Latino community. They had put up this amazing fair. They had food, they had games, they had bouncy houses, they had music, and no one showed. And so when I started dissecting the process for them, they let me know that they had placed this huge banner saying, come celebrate Mexican Independence Day with us, May 5th, Cinco de Mayo. Well, Cinco de Mayo is not Mexican Independence Day. So this organization didn't do enough work. And what they ended up doing was isolating that entire community because the community realized they don't know me. They don't know who I am. So that's cultural literacy. And without these, without health and cultural literacy, then we're looking for chaos. We'll be unable to serve those most in need who really, their reality makes it almost impossible to dig themselves out of the desperate need for our services. So as I said, workforce is your most important resource. Recruiting and retaining bilingual, bicultural individuals will take some foundational work in your part, and once you get it, you'll be able to have a phenomenal workforce. We also used to incentivize, so we would help them go through the process of becoming certified prevention specialists, which was also extremely important to them. A few of the barriers, systems and providers don't set out to make it difficult for minorities and immigrants to access behavioral health services. Sometimes the best intentions don't yield the best results. So there's, barriers to service include barriers to behavioral health care at 3 different levels. At the individual level, they're related to the individual's characteristics. What are the demographics, variables, social structure, beliefs, attitudes? And then at the provider level is relating to provider characteristics. What are the skills and attitudes? Is my staff ready to serve this community? Are we aware of what our needs are? One simple fix is a lobby or a waiting area. We had to make a lobby bigger because our families would come 3, 4, 5 individuals per family. So we had to have enough space for them to come in, and whether they were meeting with us or dropping off their youth or children for the programming, whatever it was, we had to have an ample lobby. And then there are system level barriers. And this is the organization of the prevention system. In some states, for example, they will not allow programming in other languages. Everything needs to be in English. So there are some barriers at the system level that we also need to work on. Now that we've covered the makeup of the Latinx community, health disparities, culture, language, and barriers to providing these services, let's talk about some solutions. So there are solutions at the policy level. Now, at the policy level, sometimes people say, well, you can't just ask for money all the time. But there is a policy solution that you need to have a funding mechanism. And this could be at the local, state, or federal level. And there are funding mechanisms that will allow you to be able to serve other communities. But in order for us to do that, we need to be able to work with our state office. In some offices, in some states, they developed a cultural and linguistic competence office right there at the state level. It could be an office or a division, but usually it's in the same department where your prevention programming is. And then as a policy solution, we also need to look at the implementation of the class standards. Now, members of the TTC network know that there is some movement into developing training and helping organizations implement those class standards. But then at the state level, we really should have enforcement. There are very few states that actually require implementation of the class standards, which is the National Culturally and Linguistically Appropriate Services. That's what CLAS stands for. There is also at the policy level enforcement of interpreter requirements. So, most individuals, most providers that have a contract with the state or with the federal government, there are clauses, there are places in that contract that require you to provide information in other languages. But it's usually not policed. It's usually not followed up. So providers don't implement. And then the policy solutions is what we're having to live with right now, virtual prevention services for those with limited English proficiency. At the facility or institutional level, every organization should really go through a cultural and linguistic competent assessment. No matter if you are an organization of 3 people or 3,000 people, you need to know what your baseline is. You need to know how you're addressing these barriers. Having collaborative relations with primary care providers serving minorities. I've often heard adolescent substance abuse is a pediatric issue. I think that sometimes we don't have that bridge with health providers that can help us provide the services. The organization that I founded and I ran here in Georgia for 17 years, I used the Institute of Medicine continuum. So we had a prevention branch, an intervention branch, a direct clinical services branch, and a recovery support services branch. All of them in English, Spanish, and Portuguese. And what we saw is that the prevention program was a referral source for the treatment program. So our kids would learn, what alcohol does, what tobacco does, and they would go home and tell their parents. And sometimes we'd have a parent show up, said, hey, I think I have a problem with alcohol. My kid has been showing me all this stuff in prevention. So however they got there. But then we also had in our treatment program, the children of the adults that were receiving counseling for substance use disorders were being referred to the prevention program or the intervention program. So there is a bridge that can be built. And then at the provider level, the solutions, again, providers should have cultural and linguistic competence plan. How are you going to address these issues? They need to train their staff, any type of staff, administrative staff, prevention staff, education staff, whatever it is that your organization does, they must receive training on cultural and linguistic competence. Increasing the number of providers or employees who speak other languages, and then making sure that you're consciously choosing interventions or evidence-based practices that would serve those communities. You know, key aspects of engagement, we need to increase education about prevention, access by creating most responsive service systems, bilingual, bicultural staff, enhancing education for preventionists, developing community partnerships. Most people would say, well, where can you find bilingual, bicultural staff? Well, you may not be able to find them. You may have to build this workforce, which is what we're trying to do. We're trying to bring this as a field to community places so people can become inquisitive about it. We need to decrease those barriers. You know, so many families don't seek out prevention services because they don't know what these services are. A lot of families are overwhelmed by their own migration experiences. They're unaware what the services include. There is lack of linguistic and cultural accessibility. So, you know, right now, if you can just stop and think, if someone walks into your office and they're one of these individuals with limited English proficiency, what will the person at the front desk do? What will they do? Will they ask him to have a seat till they find someone that speaks that language, or will they just tell him, no, we can't help you, right? So we need to make sure that we have that. And then speaking with our schools, you know, a lot of schools today, well, maybe not today in the world we're living in, but schools usually have liaisons with those communities that have limited English proficiency. And we need to get to know that person and see how they can help us. Creating a more welcoming environment, things as simple as how do you say hello? You know, if a family comes, you know, a Latinx family, an immigrant family, any family, how do we say hello? Have I done my homework? If this is a group of people in my service area, have I built a relationship early on and not necessarily when there is a crisis? You know, we need to build this curiosity about who these individuals are and how it's going to open those doors about how I can approach them. And then building positive experiences. You know, we all understand, you know, how we make the friends that we have today, how we have the relationships, personal and professional relationships that we have today. And some of those tools just may need a little adjustment. For example, there may be families where we may not be able to approach the child directly, or a male staff member may not be able to speak to a woman that comes in. But if I don't know that, if I don't know that about that community, then I'm going to be violating some of those rules. And I need to be careful with that. And then accessing services, you know, I mentioned about religious community leaders. It's usually one of the easiest ways. I remember when I wanted to grow my program, you know, even to this day, it's about 77 to 83% of Hispanics identify as Catholic. So I went to all the Catholic churches that had Spanish language services. And I asked the priest if they would give me 5 minutes or 3 minutes at the end of the Mass during the announcements. And I had, you know, if I could have a little table at the entrance. So none of the priests said no. Everyone, 100% of the priests said yes. So at the end of Mass, I have my couple of minutes. Hey guys, there is a new program I want to tell you about, and come see me at the table. And that's how we started building that. And out of there, that's also part of your future workforce, because you're also going to meet people who may be interested. Bringing the parents into the process, anti-stigma efforts, And then prevention services in service systems that are already accessed, like your schools or your communities. They will also lead to recruitment pool. So let me close with this. If you are an organization that is serving Hispanic, Latinx communities, first of all, thank you very much. And let us know if there's anything we can do for you. And if you're an agency that wants to open that door, I want to mention cultural and linguistic competent agencies, they view minority groups as distinct and having numerous subgroups. So you would view Hispanic Latinx communities like one of those early slides from today. 22 different countries, many differences, many similarities. You would also hire unbiased employees. Now, more and more today, we have bias testing. We want people to understand their unconscious biases, which we all have. If you're a human being who's breathing and walking, we have them. The question is, have you done your homework to see what yours may be? So we try and hire unbiased employees. It's not easy to do, but we make sure that they understand what it is we're trying to accomplish. We consult with those minority community members. And for this, it's not a 9-to-5 job. Now, most prevention specialists know that already. Our work is not 9 to 5. But in our communities, Hispanic, Latinx communities, we had a lot of success. We had 95% parent involvement. Yep, you heard me right, 95% parental involvement, because we had our meetings at 7:30 in the evening, because we had individuals that would provide childcare during that meeting. And we always had, a local restaurant would donate a few snacks and drinks, or we would bring some, right? So it's not difficult to do that. We provide the support for those individuals, so it's not just recruitment and retention, but supervision that they can understand. We want to make sure that we document. One of the things I didn't get to do as much, even though we did a few, was research, because I know we were doing something groundbreaking, and I wish we would have had a chance to do more. And then advocate to make sure that we continue to serve these communities at those levels. I'm going to stop there. Before I leave, your handout is going to have my contact information. Please feel free to reach out. And Kristen, at this time, I think we can open up for questions for a few minutes.
Yes. Yep. So if anybody has questions, feel free to drop them into the chat / questions section, or if you use the raise hand feature, I can unmute you and you can ask your question live. So I'll open up this questions tab now. Thank you, by the way, that was informative. One thing I appreciate, and I don't know if anybody else did, but I appreciate the explanation of the Latinx term. I think that's one thing that, these terminologies are always changing, and so it's helpful to have that sort of explanation and lay of the land for how to know what the terms are and how we can use them. Okay, I see some questions coming in.
Okay.
One question from Inez is, how do I reach out to a diverse Latino community who resists the substance use and who resists the idea of substance use and mental health disorders to be true. So we're connecting with a culture who has some pushback against that.
Excellent question, Inez. Excellent question. So there will be a few things that I would recommend. First of all, make sure that we understand where that messaging is coming from. So is this through personal experience? Did I reach out to this community and they told me, no, we don't believe in that? Or is this coming through another source? We need to confirm where the information comes from. And yes, there are aspects of the Latinx community that may not see excessive drinking, for example, as a problem. Is normalized when, studies show that when you put all of the amount of alcohol that the general American population drinks and the general Hispanic population drinks, the totals are about the same. But the way they consume it is different. So where the difference lies is in what is the relationship of this community with alcohol and other drugs. And what we found is that in Hispanic Latino communities, binge drinking was more popular than one or two drinks per setting. And we had to go with that. So we had to tailor our messaging based on what the community was being resistant to. And one of the benefits, or one of the things that helped us, was the youth. Youth already receive, youth assimilate and acculturate a lot faster than the adults. And when the youth end up understanding or receiving the messaging, they can bring that home. And that helped us be able to break some of those barriers. And like I said before, 95% of parent participation. And the reason we had that is that besides what I mentioned, we had a common place. So the school actually would let us use their cafeteria in the evening. And we would bring some snacks and we would bring some folks to play with the kids so the parents can focus in the message. But then who delivered the message and how the information was being delivered, it's also key. So we had a bilingual, bicultural person who was knowledgeable about prevention delivering the message. And any handouts and any information was given in the language of that community. And so that helped us tremendously to be able to educate. At the end of the day, what we found out is that Hispanics, immigrants, we all want the same thing. We want a safe place to live. We want safe streets. We want our kids not to be involved in alcohol, drugs, teenage pregnancy, violence, gangs, all of those things. We want to be able to provide a safe environment. And people responded to that. So is the messenger, the message, and how it's delivered.
Thank you. Another question, this one from Craig, writes, you shared some data that was really interesting. I'm wondering how local some of that data is gathered, or if you know about local availability of data such as English proficiency, and if you have any advice for finding that type of data at a county or municipal level. Obviously that will vary by location.
Excellent question. So on my national work, one of the things that I have found is that there's different ways to collect information at the local, county, state, and federal level. Some places just don't collect it. But when it comes to youth, to young folks, one of the best sources was not the Department of Education at the state level, but the local school. So I would go to the schools in my service area, and we had, oh goodness, I think it was 5 elementary schools and 3 middle schools, something like that. So I would go to each one of them, and they had the latest data, better than the census, because the schools collect data every year. In August, they need to know who's there, what are the challenges that the child brings, any family communication issues. They knew all that the first day of school. So I had to build a relationship with each principal, because no matter how much you know the liaison or the receptionist, you know as well as I do, those relationships are with the principal. So I had to meet with those principals, and I was able to collect the information that I needed at that individual school level, which was fantastic, because it told me which schools we needed to prioritize, which schools had the larger number of kids. And at the same time, the school was also the ones that was measuring any kind of trouble that was happening because of alcohol or drugs. So each individual school gave me the best current data.
Thank you. There was, let's see. Oh, here's another question. You mentioned that prevention is not, the prevention field is not very common and known about in other countries. This is Priscilla. She writes, I had never heard about this field before moving from Brazil to the US. How can we work to spread the word?
Excellent question, Priscilla. Excellent question. So I know that CATCA has some coalitions, partnerships in South America and in other parts of the world. I think that's a start, partnering with organizations that are already there. The World Health Organization also has prevention programming. So it would be learning where they are and what work needs to be done. And then us, as we grow this bilingual, bicultural workforce, is us getting back to our countries of origin or our heritage, and trying to meet and identify who the important folks are in the health ministries, or that would be the equivalent of our health departments or Secretary of Health, to be able to motivate this type of work in those countries.
Thank you. And then let's see, a few other questions here. We have a question from Marisol. Do you have a preferred prevention curriculum for Latinx youth community, or any particular program you could recommend?
Excellent question, Marisol. So as I mentioned earlier, we have an amazing group of researchers that have been working for almost a year developing this e-compendium. So the e-compendium is the first portion is going to be released this spring, and it's going to be an ongoing program. And I think they've reviewed 150 programs that have made claims that they're appropriate for use in the Hispanic Latino community. And they've put it through a rigorous study to be in this e-compendium, and they're going to be rating the programs based on what has been published of how they came up with those claims. And so for now, I would say that. What I can tell you, and again, it's not an endorsement, but one of the programs that worked best for me during these 15 years of prevention programming is we worked with the Mendes Foundation in Too Good for Drugs and Violence, and that program worked well for us because they had some very strong evidence that it worked, and it did work for us. We used it in our, I think, middle and high schools, and the program was really, so that's about as much as I can tell you because that's my personal experience.
Thank you. Let's see, I think there was, well, this is not a question, but just a comment from Melissa, who writes that she appreciates the point you made about hiring people who don't necessarily have the work experience in prevention, and that they have a diverse employment background experience at their agency that's worked well. So just wanted to share that comment.
Thank you, Melissa. And it is, and I can actually, say a little more about that. Not only did spreading my or keeping an open mind about these individuals, but when you partner that with that other skill, when I said someone that is willing to grow and is willing to expand, then I had some skills that the person brought with them, and then I added the prevention ingredients, and what came out is an amazing individual that got it. They got what we do in prevention, and they understood that by working with these young people, we were going to be able to give them an unbelievable chance to move forward. And then, but they also brought the skills from whatever they did previously. So, I mentioned one of them was a soccer coach, and I'm in a professional soccer player. So this individual helped us develop a Latino boys soccer league, and we had, I think, 12 teams at the end of when we ended this program. And the kids were amazing because they were using sport to be that other thing that they were doing instead of alcohol and drugs, and they were getting recognition, they were getting exercise, they were getting uniforms. I mean, it was amazing what he was able to bring, and then in the middle of that, he was delivering prevention programs. So we never know who's going to knock on our door. But yes, we must be able to keep an open mind and give individuals a chance to do this.
Yeah. I think we do have one other question. Do you have any recommendations of programs that we can take to become fluent in Spanish or improve our language skills?
Yes, I do. And usually employers don't like my answer because I believe in immersion. So 6 months in Costa Rica, I think would be a wonderful opportunity for anyone that wants to become fluent. And remember, one of the things, and I don't know if I mentioned it this morning, I may have, is I didn't say to hire a Latino or to hire a Hispanic. I said a bilingual, bicultural individual. And that's important because in my workforce, I had 5 individuals that they didn't identify as Hispanic or Latino. They were US born, European ancestry, but they lived in Latin America for 1 or 2 years. Some of them did Peace Corps, things like that. And they became fluent. So they knew the language and they knew the culture. And our families loved them because they were able to appreciate that. So yes, you don't have to be Hispanic or Latino to serve this community, or you don't have to be an immigrant to serve immigrants. You have to be bilingual and bicultural to do that. But yeah, that's what I'd recommend. 6 months in Costa Rica.
Great. I'll send a note to my employer. I'm sure that's what everybody joining in today from the middle part of the country that's very cold will be happy to hear your
That's
prescription.
right.
It looks like that's all the questions we have right now. We do have another minute or two, so if anybody has one last question they want to add in, feel free to put that in now. We'll stay here for another second.
Well, if they can still see the screen, I'll go ahead and put this QR code and this link. Again, I believe these are in your handout. So if you can please complete this for us, I would really appreciate it. And then you all have my contact information, and also on the slide, you'll have Dolka and Priscilla. So feel free to contact any of us. We'll be happy to help. We'll be happy to work with you in any way I can. We do want you to have the best workforce, especially if you're opening up to Hispanic Latino communities.
Yeah, thank you. And we do have one other About the new e-compendium in the spring, will you be sending out email or announcements about that? Or
Yes.
is there a way people can sign up to get that information?
If you've ever participated in one of our webinars, your email is already registered, so you will get that when we send our e-blast. If you have not, and this one doesn't count because this one is through the New England PTTC, so this is your listserv. But if you haven't participated in one of ours, send Priscilla an email or Dolka or myself, and we'll make sure that your email gets in our listserv, so you get all the announcements of all the activities that we have coming up.
Great, thank you. I'm sure people will be eager to get that.
Yes.
And I will also this webinar is being recorded, so we'll share the recording afterwards. So I know a couple people messaged me that they were having some getting in and out a little bit with the weather. So we'll share the video in case you want to rewatch, and I'll share the slides out as well. In case you need to check back or get some of the information that was included in those slides.
But thank you so much, Kristen. I really appreciate the opportunity to do this. It is one of our goals to expand services to Hispanic Latinx communities, and I know workforce is usually the biggest barrier. So anything we can do to continue to help all of you who are listening, please do not hesitate to let us know.
Yeah, definitely. Yeah, we really appreciate it, and I know in our New England states we do have a good population of people, Hispanic and Latino communities, as well as other communities who may not speak English, so the English proficiency is really helpful. So you can, of course, reach out to the National Hispanic Latino PTTC. If you reach out to the New England PTTC, we can also connect you to local resources, or we'll send you over to connect with Pierluigi and Priscilla and Dolka if we don't have resources to help you out. So thank you everyone for joining today, and thank you Pierluigi. We really appreciate it, and we will be in touch. Thank you.
Have a beautiful day.